Can ashwagandha help your thyroid work better? Let's take a look at this intriguing area of ashwagandha research. And let's begin with this study of ashwagandha in people who have subclinical hypothyroidism. Subclinical hypothyroidism occurs when thyroid stimulating hormone levels are higher than they should be. However, the T3 and T4 thyroid hormones are still within the normal range. So we have 50 overweight people. They're split into two groups. One group gets ashwagandha for 8 weeks and another group gets a placebo for 8 weeks. Everybody is in their mid-30s and there's roughly equal amounts of men and women in each group. So what happens? Pretty interesting results. Thyroid stimulating hormone declines by almost 20%. The T4 thyroid hormone, it goes up by about 20%, and the T3 thyroid hormone, it goes up by a whopping 41%. And what makes this even more impressive, there were no changes in the people who took placebos. In the words of the authors, ashwagandha essentially normalized thyroid function indicators and there were no side effects reported. So pretty good results, but let's circle back and take a look at those TSH levels because there's something I want to point out to you. So these people began with an average TSH level of about 6.5. They ended with a TSH of 5.3, which is still considered elevated. So what I'm getting at here is TSH may not always be normalized. And also if you're experimenting with ashwagandha for your hypothyroidism, looking at just simply the TSH level alone may not give you a full picture of what's happening. That said, overall, pretty impressive results. So what else do we have? Next up is this paper where they're telling us in the title that they gave ashwagandha to people with bipolar disorder and they saw some changes in thyroid function in some of those people. And before we go any further, I do want to point out that the results that they're showing here was obtained from data from a previously published research paper on ashwagandha in people with bipolar disorder. Okay, so let's cut to the chase. Here's a table that they show us in the paper, and as you can see, of the 10 people they're analyzing, only 3 of them was receiving ashwagandha. The other 7 people received the placebo. The first 2 people you see, they do see a slight decrease in thyroid stimulating hormone levels, but the all-star of this is the third person where their TSH level drops from 5.7 all the way down to 1.6. This essentially drops this person all the way down into the low end of the normal range of TSH. Now this data isn't exactly as convincing as the previous study, however it does add some more proof that ashwagandha does appear to be having some effects on thyroid hormone levels. And that's something to keep in mind if you decide to try this for yourself because there are some reports of side effects from ashwagandha supplements. For example, here's a report of ashwagandha causing toxic effects on the thyroid gland. This is the case of a 73-year-old woman who had hypothyroidism who developed hyperthyroidism after taking ashwagandha supplements. This caused her to have side effects including chest pains, heart palpitations, and even hair loss. And what makes this case even more strange is that she stopped taking her levothyroxine 2 years beforehand and replaced it with ashwagandha, which again adds even more evidence that ashwagandha appears to have some effect on thyroid hormones. Unfortunately, the doctors that wrote this paper up didn't tell us how much ashwagandha she was taking or what brand she was taking either. However, here's another report of a 62-year-old woman who did not have hypothyroidism who began taking ashwagandha. After about 3 months, she started experiencing side effects such as increased anxiety levels, fatigue, and elevated heart rate. What I like about this report is that doctors actually tell us she began taking 1,920 milligrams of ashwagandha before bedtime. However, what makes this case complicated is that she was taking other supplements and estrogen in addition to the ashwagandha. So was it the ashwagandha supplement or was it an interaction between the herb, the other supplements, and the estrogen she was taking? Now, while I didn't see many side effects of ashwagandha, if you're going to experiment with this herb, I do suggest that you talk to your doctor and your pharmacist if you have hypothyroidism or hyperthyroidism, if you're pregnant, if you're breastfeeding, or if you take any medications whatsoever, or you're about to have surgery. Share this video with your friends so they know this research too, and don't forget to subscribe, and I'll see you next time real soon.